What we have here is your basic Geri Chair 3-position recliner for those patients that would like to sit up in the day room or dining room or living area instead of laying in the bed during the daytime or evening time. It does come with your optional table that can be mounted and stored on the side of your Geri Chair when not in use. The Geri Chair does have a 250-pound weight capacity for your basic regular size Geri Chair. It does have wheel locks located on the rear 2 wheels that should always be engaged when placing a patient into the chair or getting the patient out of the chair to ensure that the chair does not roll away when any movement of the patient is being done. You do have an adjustable headrest for position, which is easily adjustable by simply maneuvering with a little bit of pressure from your hand. On the back side of your Geri Chair, you will have your grab bar here where you will make all your movements from. And this is the grab bar where you should always grab your Geri Chair when moving the patient from one location to another location, as well as when you will be doing any kind of reclining and changing the position of the actual back and headrest. These here are your total lock wheel locks. When engaged, they will completely lock the wheels. Simply press down on the wheel lock to engage the lock. To disengage the lock, simply press on the top side to disengage the wheel lock. Here is your 3-position geriatric reclining bar, and that is the bar that you would use to maneuver or change the position of your Geri Chair into a reclining position. To change into a reclining position, you do have to raise and elevate this bar here. There is 1, 2, 3 different mounting points in which you would be able to recline your Geri Chair to. The first position, which is in the raised position, and always ensure that your recline bar always locks into position before placing the patient at rest, because if it is not locked in position, the chair may move suddenly, scaring the patient or shocking the patient from sudden movement. So always make sure that it is engaged fully on the guide sticking out from each side, left and right side of the rear. Second position, you simply raise and hold on to your grab bar, slightly lean towards into the locks, into the second position. Of course, when you do recline on the front side, you do have elevating leg rest cushions to elevate the feet and the legs at the same time as the patient is reclining in the Geri Chair. Every time you recline to the third position, your elevating leg rest will also adjust into its full position. So make sure your bar is locked in place there. And your leg rest here will also elevate to its highest point. So we will now currently raise the Geri Chair. So we may show you how to remove the table from storage and place it onto the chair when the patient is in position in order to use it for eating or maybe reading or writing. To remove your Geri Chair table from the storage, simply slide it outward. You do have 2 guide bars here that do have mounting holes and positions for your stopper spring-loaded locks located on your left and right side of your Geri Chair arms. After removing your table from storage, you will adjust your guide arms into the correct position sliding them into the slots of your Geri chair, one on the left side, one on the right side. Okay? And simply slide it in until you get your desired locking position. If the first position isn't adequate or is too far from the patient, you do have your separate guides so that you may go ahead and release your arms and slide it back a little further. Okay. So that there is your Geri chair, basic 3-position recliner with table. Now on your headrest, we said it is positionable, and you do have your position brackets here. To adjust for patient comfort, just simply hold on to your grab bar while holding on to the top of the headrest and pushing away from the grab bar to adjust your headrest for different head elevation. Simply press backwards towards the grab bar onto the headrest to set the headrest into the laying position once again. That there is your Geri chair, basic 3-position recliner with a 250-pound weight capacity. For optional pressure management, you do have an added geriatric gap overlay for your Geri chair for those patients that do have pressure management needs for pressure reduction. This here is your plexus gap overlay with dynamic alternating pressure. It does have your male and female hoses that will connect to a control unit, which will need to be plugged into a grounded electrical outlet for proper inflation of your plexus gap overlay. This gap overlay will apply to your geriatric chair and provide alternating pressure therapy for your patient when sitting up in the chair or resting in a chair in a day room or dining room when eating dinner. To apply your gap overlay to your Geri chair on your back side, you will have a slot here which will slide over the headrest system. You will have your strapping system to strap around your headrest, around the middle body of your Geri chair, and as well as around the leg rest of your Geri chair. First, I will remove the table in order to proceed. Slide the table back into storage. First thing we will do is slide our slot section over our headrest section here. I will adjust the headrest by holding onto the grab bar and pushing forward first. Sliding that onto the headrest. And then adjusting the rest of the gap overlay in the body of the Geri chair. Okay. After you adjust and slide the head section, you will use the same method of strapping to strap all 3 straps. First, go through the 2 straps over one underneath the other one and just pull until it's snug. And then you'll do the same motion here at the body here. And as well, when you recline, your chair and your leg must come out. You will also need to strap this section here. The same method. So after securing all your straps in position and securing your gap overlay over the surface area of your Geri chair, then you can lock your Geri chair into position, and then you will have your male and female hose connections here, which are currently plugged together to keep the gap overlay from deflating when moving your gap overlay and Geri chair system from one location to another location to prevent your gap overlay from deflating completely. This here is the P6000 control unit, which is used for your plexus gap overlay system. Okay. You do have your off and on switch here, which will locate or signify power when there is your electrical power cord plugged into your electrical outlet here on the side of your unit, as well as into your outlet source, providing your electrical power. You do have your comfort control dial for patient comfort control, which should always be set to the patient's weight for normal operating use. However, to assist with patient movement or getting the patient into the chair or out of the chair, you may want to use the system on max inflate to make the actual gap overlay firm when making any patient movement into or out of the chair to assist. After putting on max inflate, then you would adjust to the patient's weight for normal operating settings. You do have on your back side your hanging brackets, which will allow you to hang your gap overlay on your Geri chair once the patient has been moved to the location where the patient will be resting for a significant amount of time. On the opposite side of your unit, you will have your male and female connections here, in which you would connect your male and female connections from your plexus gap overlay air hose. To attach your hose to your unit, simply press your quick release and disconnect your two hose connections. You want to plug your hose into the female setting until locked and you hear it snap. Then you take your other female setting and push it onto the male fitting of the unit until you hear that click into place. Once both of them are secured, simply give them a slight tug to make sure they will not disconnect easily. Your unit may be placed on the side arm rest of your Geri chair when the patient will be resting. This here is the power cord in which we would plug the power cord into the actual unit. While the patient is resting in their gap overlay, the unit should always be set into the on position for normal operating function of your plexus gap overlay. It does have alternating pressure therapy, where the unit will alternate the pressure with the differentiated cells in a 5-minute alternating pressure cycle. This dynamic plexus gap overlay, which provides alternating pressure for your geriatric chair, will provide the much needed pressure redistribution and comfort while they are sitting or resting in their Geri chair. It is designed to fit most Geri chairs, as you can see, and the simple control unit provides gentle alternating pressure therapy in 5-minute alternating time cycles to promote management and blood flow. The top sheet here is both breathable and stretchable for reduced maceration and shear. The differential cell design within the gap overlay will provide up to 4 inches of support in the crucial sacral region. The comfort control unit has an easy to use dial weight adjustment as previously shown here to soften or increase the amount of air depending on the patient's weight. And it is programmed to never exceed 32 milligrams of mercury inflation pressure for optimal therapy. Okay. If you do have any type of power loss, or the unit does become unplugged at any given time while your patient is resting in your gap overlay and Geri chair, the gap overlay will definitely deflate. To ensure that it stays inflated, simply check your power cord connection here on the side of your unit, as well as your power cord connection that is plugged into your outlet. When you are ready to move the patient from one location to the next location, and you do not want your gap overlay to deflate when the patient is being moved, simply first power off your unit, disconnect your male and female connections for your hose, plug those together as to prevent any air from escaping your gap overlay when the patient is being moved. You can put your hose here towards the back side so as it's not in the way as you're moving the chair. And of course, unplug your power cord from your outlet and then move to a new location. Most importantly is to ensure that the patient will benefit from their alternating pressure gap overlay therapy. When you do move to the new location, you want to ensure that your wheels will be locked to prevent the chair from moving suddenly on uneven surfaces, as well as make sure your power cord is plugged back in, your hoses are reconnected to your control unit, and your power is turned back into the on position. Of course, to maintain inflation and alternating pressure therapy of your plexus gap overlay, it will always need to be in the on position while in use.